Oftentimes in the more traditional PT model, you're not getting one-on-one care from your physical therapist the entirety of the session. They'll work with you for a little bit. They might work with you for like 20 minutes of the session. They might work with you for 30 minutes of the session, but oftentimes they're being passed along to a tech. So sometimes PTs will be working with 3-4 patients at the same time. So your head's kind of on a swivel in those situations. You just truly can't split your attention and give the quality of care that, you know, our patients deserve. And we definitely pride ourselves on making it custom to the individual. The MovementX approach and my approach to PT is really custom fit to the individual. It's how do we find opportunities and goals and create a plan that's going to cover everything that they're looking to get out of the process. And that might look very different for different individuals. Realistically, it has to be the approach, and that's something that oftentimes, especially in our higher volume clinics, we just don't see that. Not because the PT doesn't want to do it, but it's truly hard to have the capacity to create these really customized plans when you have 12, 15, you know, I've heard upwards of 20 patients a day, where in the MovementX model, most of our providers are seeing somewhere between 15, 20 sessions a week, 3 or 4 patients a day. I can really dedicate my time to that patient and give them the time and attention they deserve. And the model that MovementX provides, they have set up everything to be best for the provider, which in turn becomes best for the patient, because now we can spend the time, we can give the attention they need. If we need to spend an extra 20 minutes after the session to talk about what the next steps look like for a return to play for a soccer athlete, or, you know, if someone needs a little help with their running progression, and spend a couple extra minutes to talk about that, it makes it a lot more feasible than in the traditional sense. You might get backlogged on patients, so you're just seeing one after another all day long. It makes it really hard to commit that time to what the patient actually needs. The patients that I typically see are more in the athlete, you know, orthopedic cases. So that's where I spend a lot of my time. That's where a lot of my training has been. But I also have a background in working with patients who have been experiencing chronic pain. So I really cross a wide spectrum. And having worked in multiple different settings before coming to MovementX, I got exposure to patients who were dealing with a broad array of different issues. So it really allowed me to create a skill set that was applicable to high-level sports, you know, athletes, and also applicable to someone who maybe didn't do so well in the traditional sense of PT and might be dealing with chronic pain that has been plaguing them for years, and just finding what is the most valuable thing to that individual patient and then helping create a plan to get there. There really truly isn't a typical session. I would say the biggest pillars are that they're going to be with me and only me the entire time. We're going to have that back and forth. We're going to have created that rapport. And I'm going to focus on what they need for that individual day. That might look different if they're coming 2 times a week. 2 days could look very drastically different depending on what they need that day. But everything is being done with their goal in mind, and then helping communicate how we're going to get there is a big pillar that I really stand by. Our typical plans of care are usually shorter than most of the traditional commercial insurance-based clinics. So sometimes I have patients come to me for one visit. We create a structured plan for them, and they might follow up in 2 weeks. They might follow up in 4 weeks, which is not really given to them as an option. Oftentimes in the traditional sense, really a lot of times they're being told 2-3 times a week for the next 6 to 8 weeks. That might be appropriate in a post-surgical case. That might be appropriate for some people, but it's not appropriate for everybody. And that's not what typically, from a time constraint perspective, most people don't have that time to give to that. If we try to force everybody into that same frequency, I don't think that's really doing justice for the patient. And it also will turn people away from PT.